Yeah, right now, unfortunately, we're experiencing a lot of overcrowding in the Hasbro emergency department. There's a score used nationally called the NEDOC score, and the range is 1 to 200, and we're frequently scoring a 200 on it. Just today, we have about 42 patients in the emergency department currently. 12 of them are waiting to be admitted, so in an department that has about 30 beds, having 12 waiting to be admitted really cuts down our capacity as far as moving new patients through to provide the emergency care people are coming and seeking. And it's been tough, we're seeing a lot of sort of increased volume. So things just as far as febrile illnesses, viruses, I think everybody knows that COVID is increasing in the community. We're also seeing other viruses like influenza and other febrile illnesses. And we understand people coming when they're concerned, but when we see these large volumes, it's hard to manage all of the patients. At the same time, people probably know that there's a nationwide behavioral health crisis in kids going on. So a lot of kids suffering with anxiety and depression, and they're coming to seek help as well, which also is just adding to the challenge as far as trying to provide care for all these patients. So what we're sort of asking is people to understand that if you do come to the emergency department for a lower acuity situation, you may have longer waits, even several hours. Our throughput with behavioral health patients, as we're trying to assess them and figure out how to manage their issues, is longer than expected. So asking those people to be patient as well. It's been a tough couple of years on the whole staff. So in addition to having some understanding as far as what's going on, we're asking people to certainly also be kind and patient with the nurses, doctors, physician assistants, nurse practitioners, and really all of our team members, because people are working really hard to try to provide the care that we need. We know that we're the only pediatric emergency department in the region, the only pediatric level 1 trauma center, burn center, and we really are passionate about providing that care and that service to the region. But when we get overwhelmed with volume at times like this, it can be challenging. So we're also looking to our colleagues in the community as far as primary care providers to see if maybe they can extend hours, and certainly recommending if anybody has questions or concern whether they should come to the emergency department, a call to your primary care provider might be beneficial because it might be something that they can manage and prevent a trip to the emergency department. But certainly if your child is critically ill or injured, we're always here and want to be there to provide that care.
How much of this is COVID related, the overcrowding?
I would say some of it, but I wouldn't say the majority of it.
So it's a big combo of different things.
It's a big combination of just overall volume. So we're having a surge in sort of infectious illness, COVID included, but also flu and some other things. The behavioral health crisis is part of it. Some staffing challenges that we have in the hospital as far as staffing all of our beds and all of our shifts in the department. And that's some of those staffing issues are COVID related from the past 2 years and the impact it's had on the healthcare community. And we do have providers and staff that are out with COVID, so that's playing into it as well. So all of those things are sort of creating this perfect storm that unfortunately you'll feel the impact if you come in on one of the busy days in the emergency department.
So what's considered a non-urgent thing? Like what kinds of things that people say, what are the people who are waiting? What kinds of things are they coming in?
I think having a fever for some people could be a non-urgent thing. I think there are some minor injuries that would be deemed non-urgent. So, and part of the coming to the emergency department is a nurse sees you immediately or relatively soon, and they do what's called triage, where they assess what's going on and then try to see who's emergent, who's non-emergent. But I think that's where I think the question is, if you're not sure, a call to your primary care doctor would probably be helpful for them to let you know, oh no, you should go to the emergency department, or actually let's see if we can get you into the office, today or the next day.
What is the staffing situation about how short-staffed would you say you guys are, like percentage-wise right now?
It's hard to put a percent on it because it actually changes day to day with the combination of people suddenly calling out. We have extra staff working in the hospital in the emergency department, so the range is probably around 25% at times. So a lot of people are working overtime to try to fill in those holes. So you might not have 25% of shifts empty, but that's because it's being filled with people doing overtime and trying to just fill those holes.
Now, I know that we're talking about this today. How long has this issue been going on? Has it been just like the last week or so that you've seen it really kind of this perfect storm, or has it been a prolonged issue that it needs to be talked about sooner rather than later?
I'd say that this has probably been going on for about 6 to 8 weeks now. So,
Just the emergency department being pretty much full to capacity as much as you guys can accept that capacity sort of thing?
yeah, it's probably been around that. And there's been probably the past week and a half has been even a surge above that. But the challenges with capacity has probably been now a couple of months.
Do you have anywhere where you can kind of divert people to if they really need to be seen and can't be seen right away?
You know, we're the only pediatric emergency department, so it's tough. We're usually the place that we accept all of the truly, critically ill and injured kids. So instead of diverting, what I would say is, once again, calling your primary care physician. And if you need emergency care, we're here 24/7, 365. So we're really not in the business of diverting. I think we're better trying to make sure we get the appropriate patients walking through the door.
And 30 beds, that's the total number that's here, right?
So we have about a 32-bed emergency department. We have some spaces that we can flex to. We have some observation spaces as well, but yes.
And then are there any ways, looking at within the hospital besides, kind of going to a pediatrician for a non-emergency situation, are there any ways in the hospital that are being looked at as possibilities to try to expand space or allow for less of waits?
Yeah, there's definitely ongoing meetings and groups sort of brainstorming on how we can sort of tackle each one of these. How do we rebuild the staff to make sure that we have appropriate staffing for all of the beds that we have? How do we create flex plans where on days it gets busier, how we sort of flex to sort of accommodate the increased volume? How we deal with the behavioral health crisis. So whether we need to invest in, new resources or space for that is ongoing discussions as well. So all those things, people are working hard to try to figure this out. The reason to sort of come and speak today is just these are things that are happening right now, and if we can, if nothing else, set expectations for people coming to the emergency department so they're not surprised, because we know the hardest thing to do is wait. And our goal is to try to reduce waits, but maybe having that expectation that if you need to be here, that there might be a wait. And once again, calling your pediatrician if you didn't need to come, obviously that might be a better solution as well.
Then what are some of those, maybe the longest waits or the typical waits that that patients may be seeing at this time?
So, just today, there are people who have been waiting 7 hours to be seen. That was similar yesterday as well. That's really unusual for us. Usually a long wait might be 2 or 3 hours. But yeah, I saw some patients yesterday morning and they had been here 7 hours before I was able to see them.
No, you go.
Would you say this is like unprecedented, or has there ever been a surge like this before?
We have had surges before, but a lot of it is sort of similar. We had a big surge right before COVID hit, where we were seeing similar numbers, but we didn't have the compounding factor as far as the staffing. So the impact of losing staff over the past couple of years due to COVID is now being felt, and we didn't have that issue before. So we certainly have experienced surges. This one's a little different in the sense of the staffing and capacity issues. The behavioral health crisis it's not a new thing, it's been growing. COVID certainly didn't help it, and it's worse now than it was pre-COVID, but it's not just because of COVID. The behavioral health crisis has probably been evolving for about 4 or 5 years now.
And when you talk about decline in staff, pinpoint some causes for that. Is burnout a big one?
I'd say burnout is the biggest. It's been a tough
Yeah.
tough couple years. So, but people are stepping up and they're doing the best they can.